So in this piece, we're just going to talk about kind of the Eaglesoft piece of this. And so when someone enrolls in the wellness plan, what you'll do is you'll go into their edit patient screen, and then you will mark them as a policyholder, and then you'd mark that they have primary insurance, and then you would pick as their employer the wellness plan. And then what that does is that'll make it so that when you go into their treatment plan, so we've entered that John needs a cleaning, checkup, root canal, and so now we look at the treatment plan. So we've got the exam, shows $48, 20% discount for the wellness plan, $38. Wellness plan covers $38.40, so their portion obviously is going to be $0. Root canal, $683, and wellness plan gives them a 20% discount, so the fee for the root canal is $546. No benefit for the wellness plan beyond that. And then same thing for the prophy. And the nice thing is when you look at this in their treatment plan, I've got a molar here versus an anterior. It shows the periodic exams, $48, adjustment was $960, and then the benefit of the wellness plan covers that, so that their responsibility for that is $0. And then with the root canal, they can easily see that they save $200 off of what the standard fee is and what their portion is there, so that as you review these treatment plans, they can easily see that. The other nice thing about this is that, say that John's wellness plan is no longer active, his credit card failed after a few payments, or whatever, or he decided to not enroll in it anymore. Then we come in here, we mark he doesn't have this benefit anymore, and then we go back to his treatment plan. And this is probably something that we should do like with everybody, but when we look at treatment plans regularly. But if you go to view all items and then hit recalculate fees, you'll see that now the fees go back. There's no adjustments. We look at his view items by plan. There's no benefit for the wellness plan, and it goes shows what things should be with our usual and customary fees. The other piece of this is that I realize probably a lot of times with patients without insurance or without a wellness plan, you say, okay, well, let me put this plan together. Okay, it's checkup, cleaning, they need the root canal, and then you have a conversation with them about the wellness plan, which is great. And then the patient's like, yeah, I think that's probably something that I'd like to do. Or maybe you want to show them kind of the options with the wellness plan. Well, you can go in here and pick patient, and you can say, okay, well, let's edit, and then let's add the wellness plan. And then when we look at the treatment plan, we go back in, we click on view all items, and you'll see, so it's 48, no adjustments. We hit recalculate fees, and now it puts all the adjustments in. We go back, view items by plan, and it shows, okay, well, the benefit of the wellness plan will cover the fee for the exam and the cleaning and things like that. So then you can present the patient this and say, okay, well, this is what it would look like if you enrolled in the wellness plan. So I do think obviously one concern is, these patients sign up and they only make a couple of payments, and like, well, then we have to chase them around to finish the remaining payments. They make a commitment when they enroll in the wellness plan where they can pay monthly that they'll pay for 6 months. Obviously, there's going to be some patients that default on that, and then hopefully what we find is that if we sign up 100 people, that 5 people default, 95, this ends up being a good benefit for them. And it works out for us. So what we're hoping to do is reduce the barrier. Like I talked about in the prior slide or prior video, that it allows somebody to come in for checkup and cleaning for a lot less. And there's some math behind this, so that it works out and protects the practice. And the other piece of this is that, you're used to putting in a fee here or a code for the wellness plan. And there's not really necessarily a need to do that. It's kind of a separate thing. Maybe, that's something that, you could do a 999 code. Oops. If you're saying, okay, well, to do this, you need to do the, at least for today, it's going to be, what was it, 54, I think, to enroll in the wellness plan. But really, we kind of need to see this as kind of two separate businesses. We're running a little dental benefit thing on the side, and that billing with that is not completely separate, but it's not necessarily going to be tracked by Eaglesoft. So you put it in there in the wellness plan, and then as far as what you need to track in Eaglesoft, you just need to track whether or not they have the benefits of the wellness plan. You don't necessarily have to track receiving the payments, billing out for it. That's done separately. So they'll have, if someone comes in and does this, they're going to have a charge for the wellness plan, and then they'll have a charge that day for whatever treatment they decide to have. And then obviously the recurring charge for the continuing things with the wellness plan. So probably a lot of questions from that, but that's kind of how this is planned to work.